Hello Lunenburg, and welcome to your Spring Health Update. This is brought to you by the Lunenburg Board of Health, and my name is Jenna Montgomery. I'm a public health educator and communications specialist with Neshoba Associated Boards of Health. We work for your local Board of Health and 15 other local boards of health as your regional public health department. Today we're going to go over a few different things that are important to consider this time of year and moving into the summer. So we're going to talk about some warm weather safety, specifically ticks, mosquitoes, sun and heat safety, and food safety for warm weather. We're also going to talk about seasonal allergies because that's pretty important to discuss this time of year. We're going to talk about some considerations regarding summer camp and making sure that kids can have a fun and safe summer camp experience. And we're also going to talk a little bit about how you choose between an ER, an urgent care, or a primary care doctor's office visit, depending on what's going on with you. So first off, we're going to talk about warm weather safety. It's important to protect yourself and your family from seasonal health hazards to make this fabulous time of year safer and more enjoyable. So first, we're going to talk about ticks. So ticks are flightless, tiny bugs that feed on the blood of animals. They live in shady woods and tall grass, dead leaves, damp places, and both adults and nymphs, which are young ticks, can bite and spread disease. You can see in this photo here a fingertip with a few different ticks on it. Kind of gross, I know, but it highlights the different sizes that they can be, and you can see that they can actually be quite small. Ticks can be out any time that the temperatures are above freezing, and so with climate change, we're seeing more and more tick-friendly temperatures, even in what we would consider our colder months here in New England. So it's always good to be prepared. There are two common types of ticks in the north central region of Massachusetts that we see right now. The dog tick and the deer tick, which is also known as a black-legged tick. Deer ticks are very small, and nymphs can actually be the size of a poppy seed, if you can imagine that, so really, really tiny. It's important to prevent ticks. Our first line of defense against ticks is prevention of the bites. So you want to stay on main pathways in the center of a trail when you're hiking. Wear long sleeves, light colors, and pants tucked into socks. Use insect repellents and check yourself, your kids, and your pets for ticks daily. This is really important. I was tabling at the Townsend Earth Day event just a few days ago, and the number of people who told me they've already found ticks on themselves, their dogs, their kids, lots and lots of people talking about that. So yeah, they're already out there, they're already active. So what if you find a tick on yourself? Well, don't panic. You want to use fine tip tweezers to grip the tick as close to the skin as possible and pull straight out. You can then wash the area with soap and water, and you want to monitor the area where you were bitten for changes and contact your healthcare provider if you have any concerns. So the role of your local Board of Health when it comes to tick-borne disease. So positive lab results for tick-borne illnesses are reportable to the Mass Department of Public Health per state law. And Mass Department of Public Health then tasks your local Board of Health with case investigation and follow-up. So what this means is one of Neshoba's public health nurses may reach out to you to see how you're doing, ensure you're getting appropriate treatment, and to help track the spread of communicable disease if we do get alerted to a positive lab result for a tick-borne illness. We also educate the public about preventing tick-borne illnesses to help keep our communities as healthy as possible. Up next, we're going to talk about mosquitoes. Another delightful aspect of warm weather in Massachusetts. Mosquito bites can spread disease, and in Massachusetts, mosquitoes are known to spread Eastern equine encephalitis or West Nile virus. It's important to prevent bites, so you want to use your insect repellents. Try to avoid outdoor activities if you can at dawn and dusk during warmer weather. That's when mosquitoes are most active. Make sure your window and door screens are repaired and free of holes, and remove any standing water from your property. This could be like a bird bath, an old tire can harbor water. There's a lot of different places, so be sure to check your property for standing water. Again, the role of your local Board of Health, positive lab results for mosquito-borne illnesses are also reportable to the Mass Department of Public Health, and that will trickle down to the local Board of Health to do some case investigation and follow-up. So you may hear from one of Neshoba's public health nurses if you test positive for a mosquito-borne illness. Just to follow up, make sure you're getting appropriate treatment and to try to track where you got that bite so that we can help understand how these diseases are spreading in Massachusetts. Each June through October, the Mass Department of Public Health tests mosquito populations for Triple E and West Nile virus and uses the data to inform local risk levels. And there is a link here on this slide to an interactive data map that you can use to know the risks in your area. So next up, we have sun and heat safety. It's really nice to spend time out in the sun, get your vitamin D, but it's also important to protect yourself from heat and sun. Drink plenty of water to stay hydrated. Daily water intake recommendations vary by age, activity level, and other factors, but most people need at least 4 to 6 cups of water per day. Wear sunscreen, at least SPF 30, and reapply every 2 hours. Wear sunglasses to protect your eyes from UV rays. Seek shade and breaks from the sun throughout the day, especially when it's really hot and humid out. That can be very taxing for the human body. And know your own heat tolerance and act accordingly. Everybody has a different heat tolerance, so you just want to be aware of yours and know your own limits in terms of what is okay for you to be out in the heat. So next up, we're going to talk about some summer food safety. So here are a few different considerations for cooking in the summer. When you're barbecuing, you want to make sure any meats that you're cooking are cooked to temperature. If you're preparing fruit or vegetables, make sure that you're keeping your produce and cutting boards and knives separated from anything that you would be using for meats. That's called avoiding cross-contamination. You want to make sure you rinse all your produce before peeling and chopping just to get any bacteria or chemicals off of the surface of the produce. If you're doing something with eggs, deviled eggs can be really popular this time of year. You just want to make sure that when you have them out, that you have them chilled. So you could place some ice in a tray underneath them to help keep them cool. So up next, seasonal allergies. About 1 in 5 people have allergies, and seasonal allergies are one type of allergy. As we're recording this today, April 30th, I can say that my seasonal allergies have started acting up in the past couple days. So I know that's something that a lot of people struggle with. You're not alone. Per the American College of Allergy, Asthma, and Immunology, seasonal allergies, like other types of allergies, develop when the body's immune system overreacts to something in the environment, usually during spring, summer, or fall when certain plants pollinate. So this time of year can present real challenges for those suffering with seasonal or environmental allergies. And if you suffer from asthma, allergens such as pollen, dust, and pet dander can trigger your asthma symptoms and asthma attacks in certain people. This is known as allergic asthma. There is often a link between allergies and asthma, according to the American College of Allergy, Asthma, and Immunology. Not everyone who has allergies has asthma, and not everyone with asthma has allergies. Talk to your healthcare provider if your asthma seems to flare up with seasonal changes, and always follow your doctor's directions when it comes to medications for asthma. If you or your family members suffer from environmental allergies, here are some helpful tips to help decrease allergy symptoms. So first things first, it can be really hard to do, especially this time of year when it's so nice, but keep your windows closed inside your home and your car. This helps prevent pollen from getting into those spaces. Keep pets out of the bedroom because their dander and the pollen that they can carry on their fur can be problematic. Shower and wash your hair before going to bed. Change your clothes soon after coming inside. Wash bedding in hot water. Use dust mite covers on all bedding. Wash hands frequently with soap and water. Avoid touching your eyes. Monitor daily pollen counts and avoid going outdoors during high pollen times. So this is something you can usually find in your local weather report. Always consult your healthcare provider before taking medications. And if you take over-the-counter allergy meds such as Claritin or Zyrtec, Take the medication daily and follow directions carefully to be effective against allergies. And speak with your healthcare provider if your symptoms persist. So next up, we're going to talk about summer camp. It's almost summer camp season, and summer camp is such a fun time for kids making friends, having new experiences, learning how to be independent. Here are a couple tips in mind that you can keep in mind to help keep your kids healthy during their summer camp season. So first of all, make sure your children are up to date on their vaccinations and have a current well child exam on file. Vaccines are highly effective at preventing many communicable diseases. Encourage regular hand washing while your kids are at summer camp, and make sure that they're aware to swim with adult supervision only. Recreational water safety is very important. In terms of some packing considerations to have a healthy and safe summer camp experience, make sure that you pack bug spray and sunscreen. Consider either a hat or sunglasses, or ideally both. Have them pack a water bottle so they can make sure they're staying hydrated throughout the day. Pack for whatever the weather is going to bring, and include some layers because it can be variable, this being New England. And make sure that your child also has any necessary medications packed up and on board. So, ER versus urgent care versus primary care, how do you choose? This is a question that we actually get quite often. You will note that there is some overlap between urgent care and primary care. Use your discretion when it comes to these things. You can always call your doctor's office to get guidance from medical staff if you are unsure of where you should go. Ultimately, the ER should only be utilized for true emergencies, things that are life-threatening. All right, so first of all, we're going to talk about the primary care setting. You're going to see your primary care physician for well visits, and they may be a stop on your way to a specialist as well. But in terms of common medical conditions, you may see your primary care for an earache, cold and flu symptoms like cough, congestion, fever, or sore throat, a urinary tract infection, pink eye, minor cuts and burns, non-life-threatening allergies, a respiratory infection, medication refills, those sorts of things. So you're going to want to go to an urgent care instead of an ER for the following things unless your medical provider gives you different advice. You will save money, and you will probably be seen much more quickly at an urgent care than an ER. So this would be for things like wheezing or mild shortness of breath, sprains or strains, broken bones that are peripheral, minor burns without blisters, small cuts that may need stitches, fever without a rash, flu symptoms, sore throat or ear pain, eye discharge, vomiting and diarrhea, painful urination, animal or insect bite, and minor allergic reactions. Just circling back to broken bones for a second, most urgent cares have diagnostic equipment such as X-ray, and many will temporarily splint a broken bone until you can be seen by an orthopedic specialist. They will only send you to the ER if they determine that you have a break that is life-threatening. So we usually say if you have a broken bone where it's sticking through the skin, even if it's peripheral, an arm, a leg, a hand, a foot, you do still probably want to go to the ER because there's the potential for that to be life-threatening. If it's a closed break of one of those limbs, then that's something that you could certainly visit an urgent care for. If there's a concern about a major bone being broken, like a skull fracture, a spinal, pelvic, those sorts of things, that would be something you would want to go to the ER for. So the ER is reserved for serious and potentially life-threatening situations. The ER follows a triage process, which means that the most urgent medical needs will be prioritized. This means if you go to the ER for something more routine, including a broken bone that is not life-threatening, you're likely to wait a really, really long time. So some of the things you might consider going to the ER for include chest pain or difficulty breathing, weakness or numbness on one side of the body, slurred speech, vision problems such as double vision or loss of vision, severe dizziness or difficulty walking, standing up straight, broken bones sticking through skin or dislocated joints, head injuries, loss of consciousness, fainting, confusion, or seizures, severe burns, severe abdominal pain, uncontrolled bleeding, larger cuts that may require stitches, fever over 103 degrees or fever with a rash, vaginal bleeding during pregnancy, poisoning, a mental health crisis, or a serious allergic reaction. Thank you very much for being here today, Lunenburg. You can access more information regarding a number of public health related topics through our website resources page. We hope you have a happy and healthy season.